Leprosy is one of the oldest known human diseases, but many of the ideas people still carry about it are outdated or simply wrong. Also called Hansen's disease, leprosy is not a curse, not a punishment, and not a reason to isolate someone from society. It is a long-term bacterial infection that can be diagnosed and cured. Yet because it affects the skin, nerves, and sometimes visible parts of the body, it has been surrounded by fear for thousands of years. That fear has often done as much harm as the disease itself, discouraging people from reporting symptoms early and pushing affected people away from families, schools, and workplaces. To understand leprosy today, we need to separate the biology from the stigma. Leprosy is caused mainly by the bacterium Mycobacterium leprae, and in some cases by a related organism called Mycobacterium lepromatosis. These bacteria grow slowly, which is one reason the disease can be difficult to recognize at first. Symptoms may appear within a year, but in some people they may take 20 years or more to become noticeable. The infection can affect the skin, peripheral nerves, the upper respiratory tract, and the eyes. Because the disease develops gradually, early signs may be subtle: a patch of skin that looks lighter than surrounding skin, a numb area, or a small loss of sensation. Those early changes matter, because treatment works best before permanent nerve damage develops. The most important damage caused by leprosy often happens in the nerves. Peripheral nerves carry signals between the brain, spinal cord, muscles, skin, and sense organs. When leprosy damages these nerves, a person may lose nociception, meaning the ability to feel pain from injury. Pain is unpleasant, but it is also protective. It tells you to pull your hand away from heat, rest an injured foot, or clean a wound before it becomes infected. If pain sensation is reduced, a person may keep walking on an injured foot or fail to notice cuts and burns. Over time, repeated unnoticed injuries and infections can lead to serious disability and even the loss of parts of fingers, toes, hands, or feet. Leprosy can also cause muscle weakness and problems with eyesight. Muscle weakness may happen when nerves that control movement are affected, making it harder to grip objects, walk normally, or protect vulnerable joints. Eye involvement is especially serious because nerve and tissue damage can reduce blinking, dry the surface of the eye, or contribute to vision loss. These complications are not inevitable, and they are a major reason early diagnosis matters. Leprosy is sometimes imagined as a disease that directly makes body parts fall away, but the reality is more complex. Much of the visible damage comes from nerve injury, repeated trauma, and secondary infection. Preventing disability means treating the infection and protecting numb areas from injury. A common misconception is that leprosy spreads easily. In reality, leprosy is not highly contagious. Transmission can happen between people, but usually requires extensive contact over time. The bacteria are believed to spread mainly through droplets from the nose or mouth, such as through coughing, or through contact with nasal fluid from an infected person. Even then, most people do not develop the disease. Around 95% of people who are exposed to Mycobacterium leprae do not become ill, because their immune systems control the infection. Genetic factors and baseline immune function help explain why some people are more susceptible than others. This low contagiousness is central to understanding why fear-based isolation is not medically justified. Leprosy is also not spread in some of the ways people may fear. It is not passed from a pregnant person to the unborn child during pregnancy, and it is not considered to spread through genital sexual contact. People affected by leprosy can live with their families, attend school, and work. Once treatment begins, the risk of transmission falls dramatically. Public health guidance focuses on diagnosis, effective medication, monitoring, close contacts, and reducing stigma, not on excluding people from ordinary life. Historically, many societies separated people with leprosy into colonies, sometimes for life. Evidence does not support that approach as necessary disease control, and it often caused deep social and psychological harm. Doctors classify leprosy in ways that help guide treatment. One practical system divides it into paucibacillary and multibacillary disease. Possibacillary leprosy means there are relatively few bacteria present. A person with this form typically has 5 or fewer skin patches that may be lighter than nearby skin and have reduced sensation. Multibacillary leprosy means there are more bacteria present and usually more than 5 skin patches. This distinction matters because it affects how long treatment should last. Diagnosis may be suspected from skin changes, numbness, and nerve involvement, but confirmation can come from finding acid-fast bacilli in a skin biopsy. In other words, clinicians look for the bacteria themselves in affected tissue. The good news is that leprosy is curable. The standard approach is multi-drug therapy, which uses several antibiotics together to kill the bacteria and reduce the chance of drug resistance. For possibacillary leprosy, treatment uses dapsone, rifampicin, and clofazimine for 6 months. For multibacillary leprosy, the same medications are used for 12 months. Other antibiotics can sometimes be used in specific situations, but multi-drug therapy is the foundation. These treatments are provided free of charge by the World Health Organization, which is crucial because many affected communities have limited access to healthcare. Cure does not always reverse nerve damage that has already occurred, but it stops the infection and prevents further spread. Treatment is only one part of care. People with numb hands, feet, or skin patches may need education on preventing injuries. That can include checking the skin daily, wearing protective footwear, cleaning wounds early, and avoiding burns or pressure injuries. Some people may need physical therapy, eye care, reconstructive surgery, or support for disabilities caused before treatment began. This is why early recognition is so important. A small numb patch is not just a cosmetic issue, it may be the first sign of a nerve infection that can become disabling if ignored. In public health terms, curing leprosy means not only killing bacteria, but also preserving function, dignity, and independence. Globally, leprosy has declined dramatically. In the 1980s, there were about 5.2 million cases worldwide. By 2020, that number had fallen to fewer than 200,000. From 1994 to 2014 alone, around 16 million people were cured. This is one of the major successes of antibiotic-based public health programs. But leprosy has not disappeared. Most new cases occur in a group of 14 countries, and India accounts for more than half of all new cases. Because the disease is now less common in many places, it can be overlooked by healthcare workers and patients alike. Neglect creates a paradox. The fewer cases people see, the easier it becomes to miss the cases that remain. Leprosy is classified as a neglected tropical disease, a term used for illnesses that disproportionately affect poorer communities and receive less attention than their impact deserves. Poverty can increase vulnerability by limiting access to early diagnosis, regular treatment, protective footwear, wound care, and specialist services. Stigma makes this worse. If people fear being rejected by family, employers, or neighbors, they may hide symptoms until nerve damage is advanced. In some regions, legal and social discrimination has historically restricted marriage, employment, education, and movement for people affected by leprosy. Even when the law changes, social attitudes can lag behind. Fighting leprosy therefore requires both medicine and public education. The name Hansen's disease honors Gerhard Armauer Hansen, the Norwegian physician who identified the bacterium linked to leprosy. The older word leprosy comes from Greek roots associated with scales, reflecting the visible skin changes that shaped ancient descriptions of the illness. Today, leprology is the study of leprosy and its treatment, but the broader lesson reaches beyond one disease. Leprosy shows how a treatable infection can become a lifelong burden when diagnosis is delayed and society responds with fear. World Leprosy Day, begun in 1954, exists to draw attention to people affected by the disease. The central message is simple: leprosy is real, curable, and far less contagious than its reputation. The stigma should end faster than the infection. If you found this helpful, please like this video and subscribe for more explainers.